A few years ago, I decided to put together a book on prostate cancer. It was called Your Guide to Prostate Cancer, the Disease, Treatment Options and Outcomes. The book is currently in its third edition. I've been very fortunate that a number of my colleagues have acted as reviewers for the book to try and make sure the book provides a balanced message. I've also been very fortunate in that the Prostate Cancer Foundation of Australia, the Urological Society of Australia and New Zealand, and Andrology Australia have been comfortable endorsing the work. The book tries to offer you a balanced view of prostate cancer right from the beginning in terms of what a prostate is, what cancer and a prostate cancer represents, how we go about finding the prostate cancer, some of the controversies of PSA testing and being unclear as to how far the cancer may have spread, as well as the treatment options, some of which can be complex. In addition, the book looks at advanced prostate cancer and some of the issues surrounding hormone suppression therapy or androgen deprivation therapy. We look at the side effects of treatment and how they can be overcome. The book also covers some of the general health issues that one needs to consider, accepting that, for example, heart disease is still a major killer of men with prostate cancer. In the third edition, there is a new chapter by Dr. Rosie King on the sexual side effects with regard to the treatment of prostate cancer. This chapter alone is worth a read. Dr. Eddie Wooten, a psychologist who works in a urological unit at the Royal Melbourne Hospital, has also written a chapter on the psychological impact of cancer, which is very helpful for men going through this condition. As always, it's important to use this book in conjunction with the medical advice you have received. Individual circumstances do vary. Consider discussing whatever options you may want to consider with your primary doctor first and your treating specialist. Consider browsing this website further for additional resources that you may find helpful. In addition, I've also included websites that I think are worth visiting for good quality information. One of the great benefits of this book is that it has the stories of 13 men with prostate cancer. What I did with those men was we set up a tape recorder and we just talked for about 2 or 3 hours about the prostate cancer experience that they had had. The manuscript then was given to a journalist who basically created a short story out of each of the long manuscripts. Those 13 stories appear in the back of the book and are worth the read to guide yourself with regard to what a man might go through who has prostate cancer. The reader needs to appreciate that these are individual case stories and variations occur in all men of treatment. It's important to always discuss your personal circumstances with your treating doctors. The book also contains a glossary. These are some of those terms we use in medicine that you might come across during your treatment. Hopefully, like a mini dictionary, it'll help you clarify what those terms mean. As I was writing this book, it became apparent that there were so many controversies in prostate cancer. Therefore, in order to keep this book as balanced as I could, I engaged over 40 colleagues who acted as reviewers of the book. They all made individual comments and tried to improve the book as best they could. There's no way I could have done this project without their assistance. I hope in doing so the book does present a very balanced view of prostate cancer, despite all the controversy that surrounds it.